Smile evening, friends. Smile evening, all. Today we are here for continuing the Monday series from Madam Bhupinder Kaur. Actually, today is the 8th day class because we are restarting the session after a long period of vacation. So today is the 8th day. Hope that you all go through the last 7 sessions. The YouTube link was shared in the group. Now we all together can welcome our madam to this platform. Smile evening, ma'am, and smile welcome to this platform, ma'am.
Smile
We
evening.
from the Joshi Kerala group, all are waiting to hear from you, ma'am. Smile, thank you for your presence. Thank you.
Smile evening. Thank you so much for your kind words. Thank you. Smile evening to everyone. Nice to meet you. So this is a very special Monday series, and I hope that you all are revising your previous sessions because whenever I'm teaching, I always like to choose new topic. And if you are revising your previous lessons, then it is very easy. Then it will become very easy for you to, understand new topics. So I have intention to add new topics. But if people don't understand, then I have to restart. Yes. So that is why we are motivating every time that you please see your previous sessions and then so that you can catch the train. Yes. We have many subjects, many topics. If you are studying, if you're following our chain, then you can understand, absorb everything. So today, I have a very special topic for you. Very simple. It is part of Sujok correspondence system. We study in level 1. So this is like Professor Park Jae-woo, he said that when you are treating chronic cases, it is very, very important to treat a spinal section. We have to touch nervous system. Yes, brain and nervous system. So I want to explore this topic. It is also easy. You can understand. Just pay attention and I'm sure that you will understand. So let me share my screen. Okay, Sujok. You all know now, Su means hand and Jok is foot. So, hand is similar to human body. That is why this hand is a very simplified version to express all points of body. It is not just random. Yes, head, neck, chest, abdomen. So up is head, below head is neck, below neck is chest. Yes, and below chest is abdomen. Same chain, same pattern we see on the hand. So, degree of similarity, the percentage is very high, very high. That is why we get very good results. And the law of this universe says when two things are similar, energy exchange is very strong. Now, I want to focus importance of spine correspondence treatment in chronic diseases. When I use this word correspondence, it means I'm talking about Sujok. It means I'm talking about the points of spine on the hand. We are not directly touching our main body spine. Yes. So correspondence means points on Sujok. Yes, Sujok platform. So Professor Park Jae-woo, he explored this treatment, especially on the platform of Sujok, because Sujok expresses each vertebra very systematically. Yes, and he said that it is very important to treat spine correspondence in all chronic cases. And because of this treatment, because of this subject, this Sujok was recognized among medical doctors in Moscow. This is very important topic, and it has scientific roots and it has medical base. So that is why it is very popular in medical doctors field. Also, it is simple. That is why we all can understand. Sujok is very simple. So we can understand very nicely. Now, in level 1, we have a procedure that we have a lesson. In all chronic cases, we should follow 5-step treatment. Here, I'm not talking about 5-step treatment, but I have picked up a very important part from that 5-step, that is to focus nervous system in all diseases, especially old diseases. Chronic means very old diseases, grave diseases. So it is very, very important. Now, when we talk about nervous system, so this nervous system has two parts: central nervous system and peripheral nervous system. And this central nervous system is made up of brain and spinal cord. And the peripheral nervous system is made up of all the nerves, and these nerves branch off from the spinal cord. So these nerves are connecting brain with different parts of our body. So spinal cord is actually bundle of nerves which extends from the brain uh, to spinal column, and then these nerves are linked with the vertebrae. That is why these nerves can be recognized with the name of vertebra. So like L1 nerve, which is linked with L1 vertebra, so L2 vertebra, like this. That is why we can take name of these vertebrae. So now spinal cord uh, is a bundle of nerve tissue that extends from the lower part of the brain to the L1 vertebra. So it is until L1 vertebra. And then below the L1 and L2, the vertebral canal contains the cauda equina or horse tail, which is a bundle of nerve roots that descends down the rest of the spinal canal. So all these, you see, these nerves are connected with some or the other organ. So it is like sending messages. It is mediator, and it is connecting. All these organs are connected with the brain, and these nerves are playing as a connector. So in chronic cases, if we pay attention to these nerves, then we can see fast recovery. A very good recovery can be seen. So in all chronic cases, it is very important. Like I always tell our level 1 students that when you start treating, especially chronic cases, never forget to treat this spinal cord. Like, for example, person has liver problem or heart problem. Just treating heart point, heart point, heart point. It is not enough. Sometimes it is enough, but some patients need deeper treatment. Yes. So it is very, very important. Here in this group, many participants are from Sujok background. They know, but still I really want to motivate them. Please do this treatment. Then you will see a very good result in your clinical practice. Now, this is simple because we can see all vertebra, we can see very good skeleton system on our hand, and it is just resembling our human body skeleton system. You all know that this hand is representing full body: head, neck, chest, abdomen, middle 2 fingers are legs, and side 2 fingers are arm. And this we are learning in all previous sessions. You have recordings also. Yes, you have link of all our old sessions. You can refer to those recordings. So front part is representing our front body, and back side is representing our backside body. So this thumb is tilted down. Because of this tilting, we can see the spine in angle. Yes, in angle because of this tilted thumb. Still, it is very easy. We can reach a single vertebra. Also, I will tell you that in which case you should treat uh, the vertebrae, in which case, which vertebra you have to treat. I will show on my hand. Also, we will draw, and then we will understand the connection of organ with this nerve. So this is the back skeleton system, which you can see on our yang surface of hand. Yes. So I will explain this on my hand. Yes, this is like I'm showing this picture so that you can uh, keep in your records. But I love to do it on my hands because when you are holding patient hand, you are working on the skin. And when you practice on skin, on real hand, you will never forget. Yes, we will do on our hand also. So also we can focus finger system. Yes, finger system spine, finger system. You can see it is very easy because no tilting, straight like real body. We have straight spine from cervical to coccyx. It is straight. So finger system can also help us. Idea is to find the painful point. If we succeed in finding the painful point, then it is like a victory. We can easily treat any disease. That is why we have fingers. Yes, we have 4 fingers in right hand, 4 fingers in left hand. So our work is with probe, check all points. For example, we have to stimulate C3. So check C3 point on all fingers in all basic system. So when we see full body on the hand, this is called basic system, standard correspondence system of hand. Yes, and when we see full body on finger, this is called insect system or finger system, finger toe system. Yes, so finger system is easy because all vertebrae are contracted. For example, you see cervical section, just in one point, we can find all 7 vertebrae. So now we have to understand that why it is very important to treat these section, this spinal section, because now you can see that nerves, lot of nerves are coming out from these spinal column, and all these nerves are connected to some or the other organ. Yes. So one by one, we will explore that in which case you will touch specific vertebra. Now, let's say cervical, just a moment. Okay, my slide is stuck up. Just a moment, please. Okay, now it is there. So this is like cervical 1 in Sujok. Cervical 1 is here. Yes, in thumb area. So what is the work of cervical 1? It supplies blood to the head, pituitary gland, scalp bones of the face, brain, and inner and middle ear, sympathetic nervous system. So this is very important. We cannot ignore this vertebra treatment, this nerve treatment. C1, stimulation of C1 can energize all these areas. And in which condition you can stimulate this? Like headache, nervousness, insomnia, yes, and cold, high blood pressure, migraine, headaches, nervous breakdowns, amnesia, chronic tiredness, dizziness. So this is additional treatment, not just C1. Along with C1, if person has headache, then of course we have to stimulate a headache point. Along with that, C1. Blood pressure. Yes, for blood pressure, we know that we have to give attention to the heart point in main system, in sex system, mini system. Along with that, we can treat C1. Yes, again, migraine or insomnia. In this case, definitely we will treat brain point. And also, when we take history of patient, we come to know various reasons. So maybe liver is the root cause, or maybe heart, stress, stomach, it depends. But along with that treatment, we have to pay attention to C1. Now, let's see C2. So, C2. Now, eyes, it is supplying, it is connected with eyes, optic nerve, auditory nerve, sinuses, then mastoid bones, tongue, forehead. So all problems like sinus problem, allergies, pain around the eyes, earache, fainting, then certain cases of blindness also, deafness. So in this case, C2, yes, C2. Cervical 2. So after explaining these 7 vertebrae, I will show how to see on our hand, cervical. Then, just somehow my slide is stuck up. Anyway, okay. So cervical 3, this is connected, supplying energy to cheeks, outer ear, face bone, teeth, yes, and neuralgia, neuritis, acne or pimple, eczema. Now, along with your face treatment or pimple correspondent point, yes, we have to attend this vertebra C3. Yes, this nerve, a nerve attached with this vertebra is supplying energy or has connection, nervous connection, nerves connection with these areas. Then C4, nose, lips, yes, nose, lips, then mouth. So all these areas, then fever, running nose, hearing loss, adenoids. Yes, so all these areas, we have, for treating all these areas, we should pay attention to this vertebra C4. Then C5, vocal cord, neck glands, pharynx, then laryngitis, hoarseness, voice hoarseness, throat condition. Yes, so in all throat condition, we can pay attention to C5, cervical 5. Then cervical 6, neck, muscles, shoulder, tonsils. So whenever patient is having stiff neck, pain in upper arm, tonsillitis, chronic cough, in this condition, along with your neck treatment or tonsils treatment, tonsil point in Sujok, or upper arm treatment, chronic cough, better we pay attention to C6. Also, we should treat C6. Then C7, so thyroid gland problem, bursa in the shoulders, elbows, cold, thyroid conditions. In this condition, C7. Yes. Now, how to recognize these vertebrae, cervical 7? For this now, first I will show on my hand. Let's go step by step. Cervical, and then we go to thoracic. Okay, now I'll share my screen, another screen. I will show cervical vertebrae. See? Now, first pay attention to cervical vertebrae. One by one we will. Yes, cervical. First of all, you know that we should find the central line. This is the central line. Yes, this is central line. And this protrusion, this bone, this protruded bone, this is first junction. And then when you bend your thumb, here also you can find this protrusion of bone. Now this area is cervical section. Now 7 vertebrae, C1, and last is C7. Once you know C1, C7, then between C1 and C7, we have to find other vertebrae. So center C4, and then in between C4 and C1, C2, C3, this is C4, C5, C6, C7. So these are 7 vertebrae. And in finger, beauty is that in this small area, this is wrinkle area. In this small area, we have contracted 7 vertebrae. Now, how to stimulate? Practical part. Yes. Now you have seen the names of diseases. I'm telling you this practical part, how to stimulate after choosing, let's say, C3 or C4. Yes. As per the slide. For example, this is C3. Yes. Now, here, better we press this point and also surrounding point so that we don't miss the correct point. Yes. You can draw as a beginner, you can draw, you can use this pen. You can clean also after finding the point. Yes. Beginner can use this pen. After drawing, then you reach exact example C3. If you want to treat C3, then vertical position of this press, and this is yang side and bony area. That is why it is painful. If you press very deep, it is painful. Yes, so we cannot press very deep. Also, it should not be superficial pressure. We have to give pain, but we know with wisdom we have to give pain. Yes, we cannot create a cut. We cannot create wound. So press, and you have to tell your patient before pressing that we will press this point and you can get little pain. Don't worry. Yes. So now C3, but now I am pressing nearby area also, like this, like this, like this. And if you don't get painful point, you can check the same thing, same drawing on the right hand. So check. Now, after checking, sometimes this is like you have marked C3 here, but sometimes you can find point here also, up, because of thumb structure, maybe up and down. Yes. Now, once patient says that here I am having shooting pain, you stop there and then rub this point. Rub means gently rub this point, like scratching, rub this point, or roll your probe on this area. Roll like this for few seconds continuously. Sometimes we will notice in pain condition, if there is expressive symptoms, disease is having some discomfort, disease is showing pain. In expressive symptoms, sometimes just with one stimulation, patient can feel comfort. So then after massaging this area, you can massage for a minute also. After massaging this area, then you can fix seat. Now, when you fix seat, see, you can use this paper tape. Now, our target is C3. Okay. Actually, we need just one seat, but we can additionally put 2 more seats up and down so that we stay near the target. Yes, in case little bit missing, but these 3 seats will touch our destination point. So this is C3. So our center seed will touch this point. Center seed will touch this point like this. And in insect system, because insect system we have uh, 8 fingers, better we fix seed on that finger which is giving sharp pain. Then it will bring good result. Random fixing seed will not give any result. So check one by one. So here 3 points on the wrinkle, center, one up, one down. Check one by one all 3 points. And if patient says I'm having pain, okay, don't decide. You check next finger also, because this pain is sharp pain or general pain. Patient cannot compare. You have to check this finger also so that patient knows this comparison. Yes, check. One. This is cervical point. One up, one down. Yes. And wherever patient is getting pain, if patient gets, let's say, now he says, ouch, this is painful. This is painful. Stop there. Yes, you have to compare. This is bony area. Like I am pressing on my finger, I am also getting pain. So please don't reach this conclusion that, oh, this pain, maybe disease is there. No, we have to understand this point is real disease point, or this is just general pressure pain. Sometimes we are giving deep pressure also. Yes. So for this, we need to compare with same pressure. Yes, we have to check all points. And if patient says, I'm having pain on all fingers, it means our pressure is strong, deep. We have to reduce our pressure. So check 2 times, 3 times. Because one time, if you treat correct point, you will see strong, powerful result. Very good result you will see. So let's say if patient, now this is cervical, center is cervical. And now here patient has got pain. Okay, doesn't matter. We will fix it here. Surrounding area. This whole area is cervical, this wrinkle area. So this is our target. Now, if this is our target, you can mark also. You can mark also. So then 3 seats. But now this point is main. So my center seat will touch this point. 3 fenugreek seed. 1, 2, 3. Yes. And this center seat will touch my, like this. Center seat will touch my main point, this one. Of course, you know that this you have to keep for minimum 6 hours. Maximum you can keep. Whole night also, no problem, because this is seed therapy. No side effect of seed at all. Yes, this is how we will select our vertebra. C1, C2, C3, C4, C5, C6, C7. Yes, according to our disease, like you will see all slides one by one, and you will select the vertebra as per the disease. Yes, so in 5-step treatment, this is the 4th step where we pay attention to vertebra. And also, 5th step, we pay attention to brain point. At least you can start with this, even if you don't know other steps. But last 2 steps, if you add with your main treatment, it is good enough. Patient has migraine, treat brain point. Where is the migraine? Left side migraine, right side migraine. According to left and right, we go to left head point, right head point, and then we see which vertebra. Yes, you put point as per the vertebra, and then you can uh, add brain. Also, you can add one extra brain point because migraine like. So let us see next slide, thoracic. Okay, thoracic, I'll share my slide. So you want to see again. Okay, just a moment. So I can see message in the box. Quickly I can show C1, C7, C1 to C7. So this is, you can see, share screen. Just a moment. Sharing my screen. Okay, C1, C2, C3, C4, C5, C6, and C7. Yes, now thoracic. Now thoracic also, uh, about cervical section, I want to say all diseases which are in the head zone. Yes, any disease, eyes, nose, scalp, yes, lips, teeth. For this, even you like if you don't see that disease in this slide, okay, don't worry. But the clue is anything, any disease related to head area, treat cervical section for sure. You can stimulate cervical points. You can check one by one, and wherever you find the painful point, you can treat that. So for all head diseases, also arm diseases, head, arm, cervical section is very good. Now let us focus thoracic T1. Now T1, arms from the elbows, arm, elbow, including hand, wrist and fingers, esophagus and trachea. Yes. So T1, when patient is having asthma, cough, difficulty in breathing, shortness of breath, pain in lower arms and hand. Yes. So when you see these symptoms, what you will do, for example, cough. Patient has cough. In Sujok, where is cough point, throat point, also lung point, we have to stimulate. And you all are doing this treatment, what we are studying in our sessions. Patient has respiratory system problem, we focus lung point, we focus cough point, throat point, nose point, like this. Yes, now what I'm telling, along with that point, along with those respiratory system points, you also treat this thoracic one. And after finishing thoracic vertebrae, I will show on my hand. Now, thoracic 2, heart, including its valves and covering, coronary arteries, yes, and function of heart, any heart condition, and chest condition, thoracic 2. Very good. So, do it very systematically. Yes, with patience. You need patience. If we really want to help our patient, we need to have patience. Also, sometimes not just one sitting is enough. Many times one sitting, two sitting, three sitting, four sitting. If we do our treatment correctly, in first sitting, patient will show some good result. It can be 10 percentage, 20 percentage, or 50, 80, 90. Means little improvement means that your treatment is correct, and then you should continue your treatment. Don't stop your treatment in between, because if we don't have patience, then we cannot help our patient. One sitting, two sitting, yes, and then we don't do it. This is not proper treatment. Yes, this kind of treatment, if you do it very systematically, you will definitely see the result. Now, thoracic 3, T3, lung situation. Sometimes you will see repetition also. Doesn't matter because so many nerves coming out. Yes, from this T2 also, T3 also. But when you stimulate, you will come to know. Like for respiratory system issue, T2, T3. Doesn't matter. You check both. And wherever you find the painful point, that is your target. So T3, lung, bronchial tubes, chest, breast, yes, and pneumonia, congestion, influenza. So you are doing lung treatment, yes. You are doing bronchial tube treatment on Sujok system. Of course, in coming sessions, I will show all these things step by every time we are studying some of the other disease. Yes, if not touched, maybe will come in next session. But this session, today's session, is very important. In future, whenever I will introduce or whenever I will teach any disease treatment, for sure, I will say that treat spinal section also. So this session will help. You have to add with all diseases, spinal treatment and brain treatment. Yes, so this is T3. Now, T4, gallbladder, common duct problem, any condition related to gallbladder, jaundice, shingles. So in this case, we have to focus T4 and you can see the highlight. Yes, where is in this area, you will find T4. This highlight you can see. Yes, so this is the section. This is the section which is, you see, which is popping up again and again. This is showing that from T1 to T8, these vertebrae are here. And in this section, we will find T4 and I will show on my hand also. Then T5, liver disease, solar plexus, yes, general circulation. So all liver condition, fevers, blood pressure. Yes, another point, but we can check. We found in cervical also one point related to blood pressure. But if you say double repetition, it means you need to check this area also. So poor circulation, arthritis. So this point is very good. This is like improving circulation. If circulation is good, then definitely we will see good, uh, good improvement. Yes, and then C5, sorry, thoracic 5 is also in this section. Yes, there is a question. Of course, yes, finger system and basic system. People, those who know mini system, they can use mini system also. Not only correspondence system. Sujok experts, Sujok people, they know 6 key also. They know triorgan also, advanced triorgan, where we can reach, where we can open single vertebra. In 6 key also we can open because in 6 key we are studying under the banner of 6 energies. So each vertebra, each section of spine like cervical, thoracic, this is under energy field. Yes, for example, cervical, this is under heat energy. So 6 key people, Sujok participants with 6 key consciousness, they can open with the help of 6 key and participants with triorgan consciousness, those who have done advanced triorgan, they can open this vertebra with triorgan consciousness. They can reach single sector. Yes, you can mini system also. Yes, not now, but later I can introduce. Now my topic is vertebra. Mini system will take a lot of time. Now, this is thoracic 6. Please pay attention. Don't think about future. Just flow with present. My soul, mind, body, life is connected with your soul, mind, body, life. So just stay. This is very good bridge. If you really focus, focus is very, this focus is very important. Mind, we are focusing with the help of mind. Mind is a metaphysical particle world. Yes, and when we think left side, right side, kitchen, that disease, this disease in present moment, and our family, our this situation, our mind particles are scattered. When mind particles are scattered, mind loses its energy. That is why we cannot absorb properly. But if we study, it is not about studies. It is this part of smile meditation also. It is part of, if you want to achieve success in your life, collect all your mind particles and fix in one place, means attention, focus. So, thoracic 6, stomach problem. Stomach also has nerves. Nervous system is everywhere. Master nervous system is here. Liver has nerves, means liver has nervous system. Heart has nervous system. Yes, your legs has nervous system. Hand has nervous system. Nerves. You pinch, you prick any part of finger, you will feel pain. It means nerves. This is because nerves are here. Nerves can give pain. So indigestion, heartburn. Yes. So in this kind of situation, first, you can focus the correspondent point of stomach. Yes. Or correspondent point of stomach in insect system, in basic system. And then you can treat thoracic 6 point in basic system and insect system. Of course, mini system, if you're aware of mini system, you can do it. Then thoracic 7, pancreas, duodenum, people having ulcer, gastritis. In this case, thoracic 7. Where is the ulcer? And gastritis problem, duodenum. Where is duodenum? We should know where is duodenum point, where is pancreas point. And along with that, if we add thoracic 7, it will create very good effect. Very good effect. Then thoracic 8, spleen related issues, ulcer, gastritis. Yes. So in this case, if we focus spleen point, and then ulcers, stomach point, and if we add T8, it is very good treatment. Then T9, adrenal gland, all kinds of allergies, very good point. This is T9. Hives. So, which kind of allergy? Food allergy, stomach allergy, yes, sometimes sneezing. This is allergy related to respiratory system. All kinds of allergies. Very good to focus this point. T9 along with your lung point, if respiratory system allergy, lung point like this. Also problem related to adrenal gland. Then thoracic 10, kidney diseases. Yes, kidney diseases. Kidney trouble or hardening of the arteries, chronic tiredness, nephritis. So, chronic tiredness. Again, this point is very good. Immediately, we can feel we are charged. Yes, because this is all we are touching the nerves, world of nerves. And nerves is very powerful in our body. Yes, it is connecting brain with all parts of body. These nerves are the connector. So if very good energy in the nerves, yes, then automatically connection with the brain, organ and brain connection, or body part and brain connection is very good. So don't forget to treat this spinal section. T11, kidney problem, any problem, kidney dialysis, kidney stone, kidney infection, kidney disease, ureter problem, skin conditions such as acne, pimples, eczema, boils, yes, all kinds of skin diseases, this T11 point. So we need to really find exact T11 point. We have to really master this. That is why I'm telling you that when you reach general area of T11, we can do nearby. We can also touch nearby area, not just T11. We can stimulate up and down so that by mistake, if we have missed the correct point, we can touch with this. Yes. Then T12, Yes, small intestine related problem, lymph circulation, rheumatism, gas pains, yeah, and certain types of sterility. In this story also, we should focus thoracic 12. Now, how to find thoracic 12? So I will show on my hand, and then after finishing this lesson, we will draw also one by one. We all will draw together. So you be ready with your paper and pen so that you don't miss. I really want you to take result. So I will do all efforts so that you can remember all these vertebra points, correspondence system or correspondence of vertebra. So now we'll share my hand. I'll share my camera. Just a moment. Okay, see, now thoracic area. So this was cervical. Uh, this is C1 to C7. So C7 is finishing here. Just below C7, thoracic 1. Now, when you draw this central line, make sure that this line is flowing on the bony section, bony part. Here you can, when you touch this area, you will feel this bony part here, bony part. See, like this, you can feel this bone here. So just focus the center of this bone. You can feel bone is here. That is why if your line goes here in angle or this way, then our vertebra treatment will go wrong. Then no use of this treatment. That is why accuracy is very important. So first find the correct central line. And then you see that this bone is finishing here. Here. It is finishing here. Yes. And our line should align with this bone. Finishing here. Not until here. Not here. Not here. Just finishing here. Then, because of this tilted thumb, our thoracic will have two sections, upper thoracic and lower thoracic. Upper thoracic we will see in thumb area or under the thumb, and lower thoracic in this area, in the back side of palm. Now, T1, see, this is T1, and the last point, this is T12. Yes. Now, between T8, this is T8. Now, between T1 and T8, we have to fill up more 6 vertebrae. Total T8, T1 to T8, total 8 vertebrae. So, T1, T2, T3, T4, T5, T6, T7, T8. And then T9 here. Now, this place, you see, according to Sujok, middle two fingers are legs. Yes, middle two fingers are legs. And the central line will run between two legs. As per Sujok, these are representing two legs. So central line will run like this. And this is wrist line. You see, when you bend your wrist, you will find the junction. You will find the exact junction. Yes, this is the wrist area. And then you can extend this line here. You can find the deep, you can feel the deep bending on which level you can bend your wrist. And then you can extend this line after finding this deep bending on the same level. When you extend, you will find this back wrist line. Now we have central line like this. Next is that we have to divide this line into 3 parts. Now we have central line, and now we divide. One is this section, 3 parts. 1, 2, 3. So thoracic 1 is starting from here, and here is thoracic 8. So see T1, T2, T3, T4, T5, T6, T7, T8. Yes, now T9, T10, T11, T12. So on first cutting, on first division, because we have divided this line into 3 parts. So this is from wrist. If you see, this is upper 1/3. Here T12 is finishing. Okay, doesn't matter if your line is little bit here and there, little bit up and down, but idea is that you should have general idea that my T11 is here, because when you will search point with the help of probe, you will search in nearby area also. As a result, you will touch original T11 point. But I want you to practice very systematically and correctly so that you don't miss the point. This treatment is very powerful, very powerful. Only in that case, if we really hit the correct point. Nerves are attached with this vertebra, and these nerves are related to some of the other part of body, some organ. And when we harmonize this nerve, yes, the message through this nerve or curative message will reach that organ, disease organ. Yes, so if again the same pattern like cervical, if person has T4 problem, if you have decided T4, yes, it is not necessary that patient has T4 problem. But because patient has a disease, and according to that slide, if we have selected T4, we will stimulate that area and then check nearby area also. And the same pattern precedes always. Center seed will touch the main vertebra, T4, and up and down to extra. Now in finger system, I always like to treat, because this is very important treatment, spinal treatment as per 5-step treatment. This is very, very important. That is why I want to confirm and reconfirm the correct point. For this reason, I like to treat on insect system also, on main system also. And people, those who have to know mini system, you can also touch mini system point. So in finger system, see, this is like exact center. We can make center line. Until here. This is not exact straight, but please understand that we have to make a straight line. Now this was cervical. This wrinkle area is representing the cervical, and thoracic 12 is finishing. This lower phalange you can see. Half of this phalange here, T12 is finishing. T12 is finishing here. So all finger will have same pattern. All lower phalange, find the middle area. You will, middle area means just see this phalange, this area, half of this. Yes, half. Actually, finger is finishing here. But when you're finding T12, just see in this area. First, bend your finger and see this line crease. This is skin line. And here, find half. T12 is finishing here. Then, below C7, T1, T2, T3, T4, T5, T6, T7, T8. T8 on the level of diaphragm line, T8. On this knuckle, T8. Yes, and then you go next. After T8, T9, T10, T11, and T12. Equal distance you can practice. And if person has T3, T4, general idea we have that in this area we have T1 to T8. And in this area, we have T9 to T12. If person has T9 problem, we know that we have to focus this area, not this area. So this is T8, T9, T10, T11, T12. If T9, then you are stimulating this area up and down, like this. Yes, first check the point. Ouch. If this is painful, stop and then roll your probe on this point. We have to create frequency here. Yes, and sometimes pause, release, pause, release. We can sometimes choose our way according to our patient response. As patient, like in old patient, they have wrinkles here. So when we move this probe like this, because of wrinkles, it can create some wound. So in that case, we can do press, release, or you bend your finger, bend patient's finger like this. Skin should be tight. And don't forget that wrinkled skin, we have to be very careful. Yes. And then after stimulation, you know how to put the seat. And below this is this territory is lumbar, or all lower part. This is lumbar. Yes. L1, L2, L3, L4, L5. Here also, we will see PPT also, in which condition you will treat, excuse me, you will treat lumbar vertebrae. Yes, L1, L2, because this middle section is corresponding to the lumbar area. L1, L2, L3, L4, L5. So we can check one by one. And this of course, this will treat lumbar diseases also. At the same time, the nerves attached with these vertebrae, it will also, it can send a healing message to the organ connected to this nerve coming out from this vertebra. So lumbar area is this. Wherever you find the point, again, stop, press, or roll it. If wrinkled skin, then make a tight fist. This probe has a big ball also. One side is small and back side is little big. So in this case, we can, in this lumbar region, we can use this bigger size ball to stimulate this area. And in insect system, we can use this smaller ball to stimulate this area. Like this. So let us see our lumbar related slides one by one. Okay. Okay. So after T12, now you see this lumbar spine, especially for all leg diseases, like any leg problem, patient has sciatica pain or calf muscle pain or heel pain, ankle pain, sole pain. Yes, pain radiating towards the side of the leg, pain back side of the leg or front side of the leg or inner side of the leg. So we are just focusing in correspondence system, we are focusing leg correspondent point in main system, insect system, but it is very important to touch the points of lumbar. Yes, like lumbar 1, L1. This lumbar nerve is responsible for sensations around the groin and genital area, and also it has a role in motor control of the hips. So if we are treating this area, this hip area, yes, then it is very good to focus L1, L2, L3, L4. Yes, this conveys sensation for the front and inside of the thighs and extend to the inner aspect of the lower leg. Even if you don't know which vertebra, L3, L4, but simple baby tip is that all kinds of leg diseases or lower diseases like genital area, groin area, all lower diseases stimulate lumbar area, because in Sujok, lumbar area is very small. With probe, what we have to do with probe, we can stimulate all 5 vertebrae and we can check which point is very painful. Yes, so just one clue is enough that for all leg diseases, we focus lumbar. Of course, if we want to go accurate one point, then this slide, according to that, this slide, we can touch exact point. And then L5 also in um, this covers the outside of the thigh, extending into the outer aspect of the top of the lower legs. So now, as I told you, like cervical, once again, I want to revise this. When you treat cervical here in main system and insect system, any problem related to a head zone, or because cervical is near head, we can think like this. The part, any body part which is near cervical. Cervical is like neighbor. Yes, head is near, and just below the cervical, arms are also very near. So nerves coming out from the cervical going in the arm. If person has frozen shoulder or person has elbow pain, yes, you are treating elbow in Sujok. Where is elbow point? But along with that, if we treat cervical, it is very good. Very good. Result is coming. So let's see one by one. Like lumbar one. Large intestine. Along with leg diseases, now we can focus internal organ also. Large intestine problem, inguinal rings, then constipation, colitis, dysentery, diarrhea, and some ruptures or hernias. In this case, don't forget to pay attention to this point, L1. You can see this popping in the slide Sujok picture, hand picture. You can see this is the area. Why I'm showing this lumbar, why I'm highlighting this lumbar area? Like as a beginner, we don't know exactly where is L1, L2, but at least if you know that, okay, this area, lumbar is responsible or lumbar is required, at least you know that this area you can stimulate. And with the probe, you can find painful point. Wherever you get painful point, you can just add seed. Then lumbar 2, appendix, yes, abdomen, upper leg problem, cramps. Again, this can also help in difficult breathing. Yes, varicose veins, minor varicose veins, L2, L2. Yes, and then lumbar 3, sexual organs, uterus, bladder, knees. So all problem related to these organs, we should focus L3. People, those who are doing acupuncture, after finding the painful point, you can just put one needle on main point, and then around that needle, we can put 3-4 needles extra up and down, left and right. This is very good treatment. L3. Then L4, prostate gland. Now don't forget that just this point. This is additional point. We have to focus point of prostate gland. Where is prostate gland point? Here. Yes, in basic system, in insect system. We need to treat prostate gland correspondence area, or we can say prostate gland point on the hand. Along with that point, we should treat lumbar 4. Then muscles of the lower back, sciatic nerve. Yes, sciatica. For sciatica, this lumbar treatment is very, very important, especially this L4. Lumbago, difficult, painful, or if this is very painful condition of lumbar, then or sciatica pain, especially in sciatica pain, lumbar treatment is very, very important. So just treating sciatica nerve is not proper treatment, addition of lumbar points, this will make complete treatment. Then number 5, lower legs, ankle, feet. If person has ankle pain or ankle swelling, lower leg, calf muscle pain, okay, we will treat this area as per Sujok basic correspondence system. Along with that, L5 in main system and insect system. Then poor circulation in the legs. To improve blood circulation in the legs, this L5 is very good. Swollen ankles. Yes. Then, yes, swollen knees. After doing knee point, treat lumbar area and see the effect. You have to try, you have to experience. Okay. Then weak ankles, pain in the arch, cold feet, weakness in the leg cramp. Yes, all leg issues, knee issue, all kind of knee, ankle, knee, thigh, lumbar is actually main target. And if we know Sujok properly, then we can focus accurate vertebra, because this vertebra is connected to some nerve which is passing in this area. So this sacral region, this is contracted, extreme contraction is there. That is why we cannot see this good division. It is just like one piece contracted. You can see piece, one piece. So S1, S2, S3, S4, S5, nerves provide nerve supply to the genitals. So all genital related problem, we have to pay attention to sacrum. I will show on my hand after this. As well as the anus, sacrum, buttocks, and the back of the thigh. So, because this is lower part, extreme lower part, buttock when I say extreme lower part. And for like if person has piles also, or any problem related to genitals, uterus, or male reproductive organ, female reproductive organ, nice to stimulate this area. If a lady has uterus problem or ovary problem, we are focusing point here. According to basic system, this is the area where we stimulate. But don't forget, along with this, now back also we have to touch. This is sacrum region. Yes. And then we can say see one by one. Sacrum, hip bone, buttocks, and then spinal curvatures and sacroiliac condition. In this case, we have to stimulate this S1, S2, S3, S4, S5. Actually, this is fused, I told you. It is all in one. And then coccyx tailbone. Again, in rectum, anus. This will also help in piles, because in basic system, when we put seed, when we massage this area is so small, automatically we are touching tailbone and sacrum. I will show how to put seed also, because tailbone is like hook shape. So when we put seeds in this pattern, I'll show it, we can make a long chain. It will automatically touch this coccyx, and also it will touch sacrum. And this chart, this is very good chart. This chart is given by Professor Park Jae-woo. Again, this has medical base, scientific research. Lung and bronchi, any problem. Additionally, we can search all this point also. If patient has lung and bronchi problem, we have more points, more information. C3, C4, T3, T9. C3 to C4, C3, C4 and T3 to T9. We can check one by one this area. Wherever we find the painful point, there we can do treatment. Heart, ascending aorta. So this chart is prepared by Professor Park Jae-woo. Yes. So heart ascending aorta, C3, C4, and T1 to T8, all this territory. It doesn't mean that we will put seeds in all vertebra, T1 to T8. One by one, we can check. Wherever we find the pain, there we will focus our treatment. Esophagus, treating esophagus in our basic system, insect system, immune system. Along with that, we have to treat this T3 to T5. Check T3, T4, T5. Stomach, C3, C4. These are all additional points. Ascending colon. Yes. T9 to L1. Check one by one. Appendix, C3. Some connection. There is some connection. Yes, C3, C4, T11, T12. Check one by one. Descending colon. For example, ulcer in large intestine, descending colon. In this case, C3, C4, along with your lumbar lower point also, which you saw in our previous slide. This is additional information. We should add this also. Actually, it is not that we treat all points. If we have, like for example, for stomach, if we have information of 4-5 vertebrae, because nerves are there, we have a lot of nerves attached with these vertebrae. Big network is there. And in these slides, if you find 2-3 answers, doesn't matter. We can write in our notebook and then check all one by one. Wherever you find the pain, that is our target. Liver, gallbladder, yes. In this, sorry, in this case, C3, C4, T6 to T10. And here it is written to the right, like this, or to the left. You see here in this chart, or from both sides. So, like heart is tilted towards the left side, more tilted toward the left side. That is why left hand is first choice. Now, liver in the right side, so right hand is the first choice. Esophagus is in the center. That is why both side we can treat, both hand. Yes. So pancreas, C3, C4. T7 to T9, left side. Yes, because left side location. Kidney ureter, C4, then T10 to L2. Urinary bladder, T11 to L3 and S2 to S4. Uterus, T10 to L3 from both sides because uterus is located in the middle. Then ovaries, uterine, T10 to L3, testicle. And testicle T12 to L3, mammary gland T4 to T6. Also, foot, we have foot also. In foot, lumbar sacrum points are very effective. For cervical and thoracic, we can choose hand point, but for lumbar and sacrum points, additionally, we can work on foot also. We can work on hand and then additional working on foot. This will give very good result. Now I want to draw for you. Okay, just a moment. So this lesson is complete only when you know correct drawing. So finally, we need to compile this lesson. I share, just give me a second. I'm connecting with my iPad. Just a moment. Yes, it is there. Connecting. Now, one by one. Yes. So, first is you have to practice first on blank hand, then you practice on your skin. So, first is making central line. As I told you that we need to find the center point. Here you can find the bony area. Yes. And then this bone is finishing here. Okay. This is one junction. Then this is one junction, because when you bend, you can bend on this level. And then this is another junction. After this, this line, and in this area, you will find cervical. You can see this marking. To save time, I did it for you. So, C1, C7, and then find center, C4 first. 1, 7, and 4. This is like fill in the blank. In kindergarten class, we have this kind of, in mathematics, our teacher gives this kind of questions, fill in the blanks. Between 1 and 4, how many numbers, like this. It is not difficult. Only thing is we should know this is cervical section. And here we have to plot 7 vertebrae. C1, C2, C3, C4, C5, C6, C7. So when you diagnose or when you decide C4, my suggestion is that stimulate this point and also stimulate nearby area for perfection. For perfection. Treat this complete area. Complete area. Now, thoracic area, because of tilted thumb, thoracic, we will see two parts. Immediately after C7, below C7, thoracic 1, and this is thoracic 8. And now between 1 and 8, we need fill in the blanks. How many vertebrae we need? We need 6. Yes. So keeping equal distance, 1, 2, 3, 4, 5, 6. Total we have 8. 8 vertebrae. Yes. And then I have shown on my real hand also. So you can coordinate nicely. So this central line, we will divide into 3 parts. This is 1 part, 2 part, 3 part. 1, 2, 3. Then from wrist upper 1/3 will have lower thoracic vertebra. T8 we finished here. This is T9. This is T12, and between T9, T10, T11. Okay. And don't miss when you are focusing T10. Don't miss this stimulation. Nearby area also stimulate. Yes. Then lumbar, just below thoracic. This center section is for lumbar. So it can also treat lumbar pain. All lumbar diseases, we are treating this part. So vertebra between L1 and L5. Yes. This is L1, L5, and between L1 and L5, we need 3 missing numbers. Fill in the blanks. 3. L2, L3, L4, L5. So easy to remember. Here L5 is finishing. Just below L5, S1 and S5 here. This is contracted. This is S5, sacrum area. Yes, S1, S2, S3, S4, S5, and last fused coccyx tailbone. Yes, and in finger system, it is, we can see like this. Now you see that in finger, bone is, here we have bone. This is bony area. Yes, and our cervical, this starts from C1, starts from here, and then this is the last part. Tailbone is here. And where is cervical? One by one we will focus. This is cervical area. This is cervical area. It means C1, 2, 3, 4, 5, 6, 7. So with probe, when we are stimulating, we are checking center point up and down. It will cover all 7. It is very near contracted. In one point, in this wrinkle, 7 vertebra we can see. Oops, just a moment. Just a moment. Then thoracic. Thoracic is like after cervical, T1. Here in this area, it will finish. Because here there is a, skin level. You can see this is skin level. Line is finishing. So this is also one line for us. So thoracic, when we start from here, it is finishing here. T1 to T8 here. T1, 2, 3, 4, 5, 6, 7, 8. Then T8 to T8, half of this, T8, T9, 10, 11, 12, just nearby. And then just half, and this skin level line, this will cover 5 lumbar vertebra, L1, L2, L3, L4, L5. It means if we are practicing or if we are diagnosing or if we are finding point on finger, don't forget to search in all fingers. That is why we need good patience. This correct treatment can cure our patient in few sittings if we do correct treatment. But if our treatment is not targeted, then we do days and days, month also, no result. So accuracy, as per Professor Park Jevu, it is very important to find the correct point. Yes. And then lumbar is, this is all lumbar area. Lumbar area. After this is sacrum. And last is your coccyx, tailbone. Yes, this place. So now we have to make a protocol, very systematic protocol. Which disease? Which disease? So according to the disease, for example, we can take one example. Let's say patient has, we can say, a head, we can say mouth disease, any mouth disease. And as per the slide, for mouth disease, treat C4. Treat C4. Then, first thing is, I'll just let me add hand. First thing is that as per our basic system, you know, this is head, neck, chest. This is abdomen, 2 legs, side 2 fingers, arms. So mouth is here. We cannot ignore this area. This is mouth. This is mouth. So we have to treat this area for sure. In basic system, this is mouth. In finger system, this is mouth. This is accuracy of your Sujok treatment. Yes. So mouth, you will check one by one all points in basic system and insect system. Then, as per our slides, you saw treat C4 for nose problem, lip problem, running nose problem, for hearing loss, for adenoids. Yes, for all these problems. So if mouth problem, first treat mouth. If nose problem, first treat nose point. Yes, and if hearing loss, then treat ear point, ear point, treat ear point. We cannot neglect these points. After treating this target area, Then we add cervical 4. So once we finish this treatment, then we will add cervical 4. This is just example. I want to compile this. Cervical 4. This is cervical 4. Yes, this is cervical 4. And this is the main point. But I told you that stimulate up and down also. Yes, up and down also. This is how we can do. And then end of the protocol, add one brain point. Then this is called nervous system, kind of nervous system treatment. Yes. So brain point, you know where is brain point? We can, this is all brain area. This is thumb. Yes. So this is brain point. And in insect system, this is one. So first is, where is the disease in present moment? If patient is having problem in the stomach, we treat stomach in basic system, insect system. Treatment of stomach in basic and insect system does not mean that we are creating traffic on the hand. Means we are finding the painful point one by one, checking all systems, and wherever we are finding the painful point, that area we are marking and we are putting seed. After that, we are doing spinal section treatment, and then last is brain point. Then how many days? First day, first sitting, if you have done good treatment, just first sitting, if you have done good treatment, then you will see result in first sitting also. First sitting, relief. Yes. And then continue this treatment till the time patient fully recovers. First day, if you did treatment on first hand, this left hand, for example, yes, you did this treatment, and sometimes a patient has sensitive skin, so little swelling sometimes because of pressure. You can do second day, you can do on the right hand. But if no swelling, skin condition is good, then at least 3 to 4 days you have to treat. You should treat the same area, same point, because we have generated frequency there. Not advisable that you keep changing point again and again, and you're not allowing that process to take place. So we have to do it once we have decided and we did hard work. General idea we can write in his case history that I found point, and maybe you can have blank hand on your writing pad, and you can mark that you found point here, so that next day you can search in the same area. After 2-3 days, then you can change hand like this, because sometimes patient needs 1 sitting, 2 sittings, sometimes 4 sittings, sometimes 10 days sitting. According to the skin condition, we are changing hand and finger, but don't change quickly. Yes. So this is what I wanted to tell today, and in next session we will explore more. Also keep this notes related to this session. Preserve, save these notes, because you have to use this spinal section treatment in all diseases. Okay. So
Smile, thank you, ma'am. Smile, thank you. Actually, it is very helpful for all the healers as well as for the patients, because all the vertebrae and the nerves are related with our internal organs. And now today's session, you are very nicely and very detailedly explained how it is related. So it is very helpful, ma'am. Thank you so much. Smile, thank you. And thank you all participants for your patience. After completing the sessions, you will get a direct interaction with Madam Bhupinder Kaur. Because of the time concession, we cannot extend the class beyond 10 o'clock. So you can keep all the questions with you. Thank you so much for your understanding also. Smile, thank you, ma'am. Smile, thank you.
Thank you. See you next Monday.
Yeah. Thank you all
Thank
participants.
You. Smile, thanks, ma'am.
Smile.
Thank you so much, ma'am. God
Thank
bless
you,
you.
ma'am. Thank you, ma'am. Smile, thanks.
Thanks, ma'am.
Thank you,
Thank you,
ma'am.
ma'am.
You.
Thank you, ma'am.
Thank
God
you.
bless you.
Thank you,
God
ma'am.
bless you.
Professor
Thank
used
you.
to say, keep
What a wonderful
smiling.
section.
Thank
you, ma'am.
I want to
Thanks.
add one sentence. Professor used to say, if disease in any area, in any part of body, it means that part is not smiling.
Namaskar, madam.
Sometimes it is very strange to, focus this, because we are always thinking that it is smiling, lip is smiling, but our stomach also needs smile, our vertebra also needs smile, cervical also needs smile, because trillions of cells are there in our body, and each cell has soul, mind, body, life. So if stomach problem, it means stomach mind is not smiling. Heart problem, heart mind is not smiling. Then how to smile? We'll have this session also, smile meditation, part of smile meditation.
Thank you.
Thank you so
Okay,
much
thank
for your
you.
kind consideration about each participant, ma'am. Thank you so much. Thank you.
Smile night.
Smile night.
Well, thank you, ma'am.
Thank you.
Thank-
Smile.
Thank you, ma'am.
Bye.
Bye.
Thanks.
Bye-bye.
Smile thanks and smile night to all. Now
Thank you.
I'm going to end the session. Thank you all.